Hi, this is Andrea Kane, and I'm here with you for HIT 421 Legal and Release of Information. We are on Chapter 2. This is Week 1, and our unit objectives are still 9.1.1 through 9.1.16. And you can take a look at your syllabus if you want to see specifically what those are. But this chapter is all about law and ethics. If you want to follow along in your book, we are on page 13. So let's move on and see what is in store for us this week. Well, actually, for the rest of this week, because you've already had Chapter 1's lecture video. So, law and ethics. What is the law? What is ethics? Are they the same or are they different? According to your book, law and ethics are closely intertwined, and they really are. One of the challenges is what happens when the law is not ethical and what happens when the ethical is not law. Both are challenges. Ethics are a combination of individual morality, expectations of reasonable human behavior, and obligations to act appropriately based on profession or philosophy. So essentially, the law we talked about, those are the rules that are put into place to govern us. Ethics are moral values. Applied ethics involve medical ethics and professional ethics. And your book does a really good job of defining these for you on page 14. And it also goes into bioethics, how matters of life and death in the use of biological and medical technology are also a part of this. So make sure you look at those definitions and that you're very familiar with those. Ethics in healthcare. We as HIM and informatics professionals have an ethical responsibility to patients. I would also insert in here the patients, providers, healthcare organizations, the profession, our employers, pretty much everyone. We have an ethical responsibility to do what is right, to know the law, but also to do what is right, even when, especially when no one's looking. And choosing to be ethically responsible is the best way that we can show our not only our respect but our commitment and how we can help others we can make a positive difference in the world of healthcare by maintaining ethical responsibility and making sure that patient rights, especially as they apply to privacy and confidentiality, are maintained. Unethical behavior can have the same repercussions as illegal behavior. Absolutely. People who do unethical things can end up paying a price legally. An example, many of you have taken coding classes or are in coding classes right now. Intentionally upcoding, intentionally maximizing and getting a higher DRG than what is appropriate based on the documentation of the record, that's called fraud. And the government can prosecute you civilly, you as an individual, civilly for that kind of behavior. So there's a lot of things that can happen. Again, there are unfortunately individuals who have had access to health information about people who have a celebrity status. And they have chosen to sell that private and protected health information for money, usually to some type of media outlet. And that behavior is not only incredibly unethical, but it's illegal as well. And people not only lose their jobs, but they can be sued for that. So having ethics and choosing to be ethically responsible are very important because in our world, many, many times they are tied to illegal behaviors. And one of the things that I have found in my years as being a leader and manager, director, however you want to call it, administrator, is that if someone's going to behave unethically, it's going to turn into a pattern. And sooner or later, that pattern will catch up to them. I've just seen it happen so many times. So that is why I really urge everyone, choose to be ethical. You may make a mistake along the way, but if you have a pattern of ethical behavior, when you do make that one mistake, you are in a much better position to recover from it than if you have a pattern of unethical behavior. And unfortunately, mistakes that are made do follow individuals. So some ethical theories. There's one called utilitarianism. There's another deontology. I'm going to, again, guide you back to your book for this information. This is all on page 16. Also, right-based ethics versus virtue-based ethics. These are all good things, but just need to know the terms to understand the different ethical theories. And then we get to ethical principles, where you have autonomy, beneficence, non-malfeasance, and justice. These are the four main ethical principles that you need to be aware of. Make sure you know what they are and what they mean, and examples of each one. Because hint, 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 it will be on your quiz. So here's some examples. And if I were you, I would not only know these examples, but be thinking about some others. Think about things in your life or someone else's life, and think about how these would play out. And not just in the HIT world, but you can think about it whether you're talking about school or home or work or family, all those different types of things. Professionalism. This is the qualities that characterize a particular profession. It can be changed. Sometimes it changes based on age, education, position, or work setting. But professionalism is basically the expectation of how you are to react, how you are to act as someone who has reached that point in their knowledge and experience. And we will cover this in the summer, this coming summer. If you have, I think it's HIT 540, where you're going out for your first professional practice experience, I believe we read a book about professionalism. So we'll get deeper into it. But for the purposes of today, it's just really important you know what it is. Conflict of interest. This is huge. A lot of the corporate compliance laws have benefited everyone by bringing this up, because often people have a personal interest in something, and that personal interest often gets hidden so that they can benefit from it based on the official responsibilities or duties that they have. And this is called a conflict of interest. And it's not that it's bad to have a conflict of interest, as long as you do not act on it, as long as you're open and honest about it. So let's say that a physician is involved in a joint venture. Maybe a group of physicians is involved in a joint venture with a local hospital opening an ambulatory surgery center. Because they're doing this joint venture, they've invested money into it. It's fine that they've done that, but they need to make it open to patients so that they're not directing patients to this ambulatory surgery center and making money off the patients, when possibly that's not the best thing for patients, or possibly the patients just need to know that there's a personal interest here. It doesn't make it wrong, as long as it's open and as long as those who are making the decisions still have the ability to choose. Another example would be a hospital that owns a nursing home, a skilled nursing facility, and they have patients in the hospital who now need skilled nursing facility care. They have to be upfront with the patients and give them a list of all skilled nursing facilities within the area, and they have to note on there which ones they own or have some type of interest in. It would not be right, it would be a conflict of interest if that hospital only let patients choose the skilled nursing facilities that they owned or had some type of financial stake in. That wouldn't be right, especially if they weren't open and honest with the patient about it. And these are examples of conflicts of interest. It can be as simple as someone who has a sibling, a brother or sister, who works for a company, and that company makes a product that the hospital decides it needs. If that person is on the team that is deciding where to award the contract, and they don't disclose that their sibling works for the company that they're pushing hard to get that contract, that is a conflict of interest. They need to be open and honest and say, hey, I have a sibling who works for company XYZ. I think their products are great, and I'd like to encourage that we look at them, but they can't insist that the contract go to company XYZ because they have a brother or sister there, and because the brother or sister may have said, well, I'll give you a 10% cut out of whatever we make as profit. And that's unfortunately what too often happens in our world, is that there are these secret personal interests. They aren't open about them, and they make decisions so that they get money back for them. And that's where it's a bad thing. That's where conflict of interest becomes bad, is that you're deceiving people or not being open with people about why you're directing them in the way that you are for your own individual financial gain. So most hospital organizations, especially the ones that are really on top of things, make all of their people who are involved in decision making that involves purchasing, including department directors, disclose all of their investment and in personal interest, not investment, personal interests, so that it's very clear when these decisions come up, they step away and someone else makes the decision. That way there is no conflict of interest. So I know I've harped on that long enough, but that is a big deal. That is unethical not to disclose your conflict of interest and step away from that decision. And it's a part of being a professional. You do the right thing. Professional Code of Ethics. AHIMA has a professional code of ethics for all of us who have credentials through them. And these professional code of ethics reflect the values and principles defined by our profession as acceptable behavior. And they're guiding principles. They are a benchmark for what constitutes practice in malpractice, negligence, other litigious situations. And they do get changed as time goes by. But I would encourage you to take some time and go out and look at the AHIMA Code of Ethics. In fact, I think this week you have an assignment on that to make sure that you're familiar with these. But every year when we have our credentials renewed, or our membership with AHIMA renewed, we sign off that we are going to abide by these professional code of ethics. And if we don't, AHIMA can come back and take back our certification and release us from membership. And that's only rightfully so. If we do something bad enough against the code of ethics, we should not be allowed to continue on behalf, because that reflects on the profession as a whole. So, they take us to some examples. One is the AMA, talking about how a physician shall respect the rights of others and safeguard patient confidences and privacy. AHIMA, here you go. This gives you a little bit of it. It's not all of it, but it's a little bit of it. And what the Health Information Bill of Rights is for protecting healthcare consumers. And how we use patient information. And vendor contracts. Now on to ethics committees. And in your book on page 21 is the AHIMA Code of Ethics, at least as it was in 2011. I do not know if it has been updated since 2011, to tell you the truth, but it looks fairly familiar to me. I don't really see anything that is different because I just signed off on mine at the end of December. Anyway, make sure you read through that and that you're familiar with that. Ethics committees. We are now on page 24 in your book. Every healthcare organization has an ethics committee, and that's a good thing. It's a standardized approach to ethical decision-making in the healthcare organization. People are able to bring questions to the ethics committee. Physicians are able to take patient care situations and scenarios there and get definitive answers, ethical decisions that help them follow through into the next steps. And so there's a 7-step ethical decision-making model. And I would like to say that I believe that these steps are on your quiz. So make sure you know what these 7 steps are. And it's probably a good idea to know what order they are in. Hint, hint, hint. Blanchard Peel Ethics Check. This is on page 26 in the middle of the page. This is a well-respected decision-making guideline where you stop and you ask yourself 3 questions. Is this legal? Is it balanced? And how will it make me feel about myself? It's bringing in your conscience. Will you be okay if you make this decision one way or the other? Bioethics is here at the bottom of page 26. Your book does a really good job of going through it. Bioethics continues to be a concern, especially as we talk about a lot of DNA and other activities that involve changing as technology advances, and there are different test treatments opportunities now that there weren't 10, 20, 30 years ago. And some of them may be more ethical than others. Some may be okay to one person and not okay to another. An example I can think of is stem cell research versus embryonic stem cell research and those types of things. A lot of ethical dilemmas focus on the beginning or the end of life. That's a lot of times where you see ethical issues focused. And so this is just examples of that. And genetics, I talked about that. Gene testing, gene therapy. So getting back to law and ethics. Professional codes of ethics impose a duty on healthcare professionals to conform to professional standards of practice. As patients and professionals are presented with ethical decisions, utilizing standardized decision-making models that we talked about, the Blanchard Peel Ethics Check, as well as the 7-step model of ethical decision-making. Those can be beneficial in considering all influences, avenues, and barriers to make the best decision. And then advancements in science and technology continue to create ethical issues. So ethics committees will continue to be very needed, and people who are knowledgeable about ethics and ethical decision making will continue to be helpful to the healthcare community at large. And that is the end of chapter 2. So that should be all set. It looks like you have 2 discussions and an assignment this week in addition to your syllabus review and quiz. And you also have a quiz over chapters 1 and 2. Next week, we will be back with week 2, studying chapters 3 and 4. Take care and have a great rest of your week.